Hi, today we're going to be talking about that video that we just watched for class, Supplements and Safety. It's the full documentary regarding hidden dangers of vitamins and supplements. Pros and cons are up first for the discussion. Um, I guess to just start off, pros of supplements are definitely going to include being able to just get vitamins, nutrients that you wouldn't necessarily get from your regular diet. Now, to me, it stands out for someone who maybe either has an existing condition that would limit them to be able to get the nutrients and supplements, vitamins, anything that they might need because of the problem, maybe a medical issue or something of the sort. But another reason might be because they have a type of eating issue, maybe a hurdle that they need to overcome. One might be vegan or vegetarian, or also could be maybe even lack of teeth, so the inability to chew certain types of foods. All of those things can sort of come into play, but a pro for the supplemental intake would be to be able to get those vitamins, supplements, those type of thing into their system without them being able to without the supplements. The cons to the supplements that seem to be on the market, especially after watching that show, is not as easily described. So the cons are obviously us not knowing what is actually in those capsules. So the fact that those capsules are just sort of like any old Joe Schmo can just create a capsule and put it on the market and have it be able to be purchased and consumed by a person with possible detrimental effects later on, or even right away, that's a little bit concerning. So I would chalk that one up as a huge con, just sort of not knowing exactly what is in those capsules or liquid or whatever it is, whatever type of thing. It could be a drink, it could be anything that isn't regulated by the FDA seems to be sort of a con. It's like not really knowing what ingredient is in it. That is a huge con to me. If I had a patient that came to me and they were sort of self-prescribing these supplements, I definitely would ask if they have a primary care physician that they're speaking with, visiting regularly, having, those labs done that are appropriate for those types of medications that they might be taking, supplements rather, to be able to just have a patient come in and say that they might just take all of these different things without having some sort of baseline, a level that maybe they're either starting at or trying to reach. They're really just taking items that maybe aren't even giving them the correct things. When watching this documentary that was assigned, it's shocking to know that all of these supplements taken by all sorts of consumers, kids, elderly, people who might be trying to self-medicate with like a chronic illness or something, they're using these medications or these supplements that are not proven, essentially. I did enjoy watching the part on the video where it talked about certain brands that are being cooperative with this testing procedure, and with a patient, I would definitely refer to those types of supplements. Now, after making sure that they have a primary care physician that maybe set a baseline for them or told them, this scientifically is the supplement that you need, and that this particular supplement from this particular company is proven, and it has been shown that it is that particular vitamin or mineral or whatever it is that patient would need, then I would definitely say that would be appropriate for that patient to take those supplements. Now, if it's truly self-prescribed, I would recommend that patient go talk to a doctor right away, to make sure that they're not harming themselves. I mean, you have those patients who are taking supplements and then, months, years even down the road, suddenly they're having all these crazy issues, and it ends up being linked back to these supplements that they were taking just because the bottle told them that it was going to be fine. Things that I gained from the video are I actually walked over to my kitchen and I got out all my supplements to show myself that these things are not truly regulated. I'm surprised actually to find the first one was the gummies that I give my kids. These are just sort of like a regular children's gummy. I'm just always concerned that my kids are not getting enough vitamins throughout the day. They're in school. We've got different things that they're involved in extracurricular, and I want to make sure that they're not just constantly getting those colds, those viruses, those whatever. But of course, when I look at it, it says these statements have not been evaluated by the Food and Drug Administration. This product is not intended to diagnose, treat, cure, or prevent any diseases. Yet it has this fun, cute little label that says, children's gummy, and it has this little bear on it, and they're even shaped like gummy bears, so they look like candy. My girls say they taste great, but looking at the back of the label, it does show 250% of vitamin B12 is going to be in 2 of these gummies. It says give each child 1 or 2 gummies as per the child's age group, which is listed on here. So mine would each take 2, but we're also 200% of biotin. Why am I giving my little tiny ones biotin? Isn't that like a hair, skin, and nails thing? So it's really got me questioning a lot of things that I might use in my own home, and even having my children combined with that. There's also other ones like this one right here. It came in a pack. I believe this was, I think it was on the TikTok shop, super popular, vitamin D3 and K2 2-in-1 formula, and it says 5,000 IU of D3, but that was specifically in the documentary that says that you're really not supposed to have more than 5,000. So now I'm questioning everything anyway, to get back to it. But I do have 2 medications that I take that are actually prescribed by my doctor. Those I feel confident that they are what they say they are in the bottle, being labeled by an actual pharmacist and someone who is held accountable for those things that might be given to you as a patient. Very, very confident that that's what those are. I'm a little bit concerned with these other 3 that I take, since none of them say that they're, have the FDA's approval. So very interesting. This was a great assignment. I loved this one. The insight that I've gained from this video, I think, is by far one of the best assignments for the semester for this class. So thanks so much for listening.